Chairman of the Board of Trustees. They never gave me a gavel before, so this is a pretty exciting night for me. But I did need it to call you all to order. We're really excited to see so many people here. I hope the sound system is working and you can hear me okay. We have a fairly extensive agenda for this evening. It includes a presentation by our CEO, Tom Beeman, and 3 presentations by local and national healthcare experts. So the way it will work is we'll start with our regular hospital board meeting. We're planning for that to last about 45 minutes. Towards the end of that meeting, there will be one presentation, and then we will take a break, and there will be food next door for those of you who are hungry, and there's also some booze out to the side on some of our areas. And there will also be a booth which is not the kissing booth, it's the issues booth, and that will be manned by myself and the Vice Chairman, Claire McCormick, and we would be happy to take questions that come up to you in the meeting that about what we're doing and why. We're not going to take questions at the board meeting because we have a lot to get through, but we'll also be other board members out there eating the food, and hopefully you'll mingle and ask questions of them as well. And the booths out there you'll see are Project Access, Lighten Up Lancaster County, and Tobacco Free Coalition. And there'll be representatives to talk about what we're doing there. We'll then reconvene here at 6:30. Dr. Stephen Peskin will discuss myths and realities of population health management. And then we'll have one more presentation, and we hope to adjourn by 8:30. And the speakers will, if time allows, take questions on their areas of presentation. I think we have around pens and pieces of paper, and if you would like to write down an email address, or if you have a question, if you want to turn those in, then we can put you on our list and answer questions if you have them, or keep you on our email list for updates. So that's essentially what is planned, and I'd like to start by calling the meeting to order. And I normally begin with a brief meditation, and really in lieu of that, we're going to have a resolution honoring a colleague of ours who has done a lot for this community and this hospital. But before we do that, I'll read you a brief meditation, and this is from Dr. Martin Luther King Jr., and it really relates to the resolution for John Shirk, which you'll hear momentarily. And what Dr. King said was, life's most urgent question is, what are you doing for others? And you'll hear a little bit about what Mr. Shirk did do for others. So I would like to begin by asking for a motion to approve the minutes of our October 20th, 2011 hospital board meeting, which had been previously circulated to the board.
Move for approval.
Second.
Motion and second. Any additions or corrections to the minutes? If not, all those in favor of approving the minutes say aye.
Aye.
Any opposed? Motion carries. The minutes are approved. Thank you. And I'd like to turn to our counsel, Bob Macina, to address the board resolution.
It has long been the practice of the Board of Trustees to approve resolutions honoring the members and board members who have passed away. It's an opportunity for us to reflect on their accomplishments, their contributions, and their humanity. The trustees are extraordinary people. They give their time, their energy, their talent, and they receive nothing for it other than the knowledge that they have helped to improve the quality of life in this county. They speak for the community. They are the community's representatives here for this institution. They make critical decisions about the resources that will be dedicated for the benefit of those who seek out our services, and they certainly are worthy of being honored and remembered. Today I present for the board's consideration a memorial resolution honoring John Shirk, who passed away last week. I was talking to one of our current trustees just last night about John Shirk, and this trustee said, John was the perfect trustee. And I was so impressed about that I decided to steal that to talk to you about it today. And there are a lot of reasons why he might be the perfect trustee, and I'm going to only give you 5 or 6 that come to mind. First of all, he always came to meetings and he was always completely prepared. Second, he knew what to say and when to say it. He also knew when it was better not to say anything at all. And when he followed those 2 things, when he did speak, we knew it was going to be something significant. He knew how to take highly complex matters, break them down into their individual components, and then give you simple opportunities for decision-making. And he brought to decision-making common sense and pragmatism, something that is frequently rare in attorneys. And finally, he knew how to get things done. John was passionate about Lancaster General, and in preparing for today, I actually found a letter that he wrote in 1995 when he was stepping down as the chairman of the parent corporation. And in that letter he wrote, "The hospital and Lancaster General are without a doubt the finest organization I've ever been privileged to be associated with. There is no doubt that we make our share of mistakes, but looking beyond that to what we accomplish, the organization is unique. The degree of organization and efficiency is unparalleled. The ability of the institution to marshal resources to focus on important problems rapidly and effectively is awesome. The quality of care that we and our fantastic medical staff provide to the citizens of Lancaster County is first ranked on a national level. The institution has continued to have a clear sense of its mission and ability to plan years ahead to meet community needs. It has been a real honor and a privilege for me to have had the opportunity to participate with such a fine group of people in such a fine organization." Well, John believed that in 1995, and I know that he believed it in 2011 also. Over the past 118 years of this institution's existence, there have been many trustees that have touched this institution in a vital way. But I think I can say with a high degree of certainty that no one had a greater impact on Lancaster General than John Shirk did. It was my honor and privilege to work with him, and I know you all feel the same. So, Mr. Chairman, I will offer the following resolution, which is at the place of all of the trustees, and I will read it aloud for the purpose of the group that's with us today. John O. Shirk, Esquire, recently died at the age of 68 years. He left an outstanding record of accomplishments. Mr. Shirk was born in Kokomo, Indiana, and relocated to Lancaster, Pennsylvania in 1956. He graduated from Princeton University's Woodrow Wilson School of Public and International Affairs in 1965, and the Law School of the University of Pennsylvania, magna cum laude, in 1968. Mr. Shirk was a law clerk with the Honorable Theodore O. Spalding in 1968, and then began his career with what was then Barley, Snyder, Cooper, and Mueller in 1969. He was named a partner of the firm in 1973 and acted as a managing partner from 1983 to 1993. In 1993, Mr. Shirk stepped down from the management position to concentrate on practicing law and remained active as a senior of-counsel attorney for the firm. Mr. Shirk was known for his ability to think strategically, to communicate clearly and concisely, and to solve complex problems. He was a trusted legal advisor. Mr. Shirk's life was also noteworthy for his service to the community. Mr. Shirk was a tireless advocate for economic revitalization and development of the city of Lancaster. Among other things, in 1990, he chaired a steering committee to evaluate the Hayden Report, a study that offered sweeping recommendations for revitalizing downtown Lancaster. In 1991, he chaired the Downtown Task Force, which urged the creation of the city's Downtown Improvement District. Mr. Shirk was one of several business leaders who founded the Lancaster Alliance, meant to improve economic and social conditions in Lancaster City. He was a past president of the Economic Development Company of Lancaster County and the EDC Finance Corporation of Lancaster County. In addition, he was a past president of the board of the United Way of Lancaster County and served on numerous other boards, including the Lancaster Chamber of Commerce and Industry and the Pennsylvania College of Art and Design, to name just a few of them. Lancaster General Health was very fortunate to be the beneficiary of Mr. Shirk's energies and business acumen. In 1983, Mr. Shirk was a founding board member of the Lancaster General Hospital Foundation. He continued to serve 15 years on that board through the transitions of the foundation to the Lancaster Health Alliance and Lancaster General. He held the position of chairman for 4 years from 1991 to 1995. Additionally, Mr. Shirk served as a trustee on the Lancaster General College of Nursing and Health Sciences Board. During his 24 years of service to Lancaster General Health, Mr. Shirk also served as a member of many board committees, some of which included Finance, Executive, Strategic Development, Management Development and Compensation, Governance, Joint Conference on Quality. Mr. Shirk was an essential part of most of these strategically important decisions facing the institution for the last 30 years. Now, therefore, be it resolved that the Board of Trustees of Lancaster General Hospital hereby adopts this resolution to pay tribute to the valuable contributions made by John Shirk to Lancaster General Hospital and the Lancaster community. And be it further resolved that the Board hereby expresses its gratitude for Mr. Shirk's long and outstanding service to Lancaster General Hospital. And be it further resolved that the Board of Trustees extends its sincere condolences to his family, friends, and colleagues. And be it further resolved that the Board directs that a copy of this resolution be placed in the permanent meeting minutes of this meeting, and a copy be presented to Mr. Shirk's family. Mr. Chairman, I submit this for your review and approval.
Thank you, Mr. Macina. And I'm sure most of us here could add to that, could tell a story about John, but at this point I will simply ask for a motion to approve the resolution.
So moved.
Second.
There's a motion and a second. Thank you very much, Rob, for drafting that. That was a fine tribute. All those in favor say aye.
Aye.
Any opposed? The motion carries unanimously. Thank you very much. Before we turn to the report of our Chief Executive Officer, Tom Beeman, I do want to mention that we're also broadcasting this meeting live on our website. And I'd like to welcome those of you who are participating via the internet. I'm glad you can participate as well as the wonderful and large group we have here. Mr. Beeman.
Well, I was fine until I found out we're being broadcasted on the internet. I'm really excited to be in front of you this evening. I'm excited that all of you are here. I was really excited when Alex said there's free booze outside, but then I realized he said free booze. That's all the years I spent in Nashville. I misheard him, I'm sure. So unfortunately, we don't have free booze, but we have a lot of really good information that we hope you take advantage of. I wanted to run through a little bit about Lancaster General and some of the initiatives that we've had going over this past year. Of course, all of this work is done in the association of what I consider one of the finest leadership teams and staff that I've ever worked with, and that includes our incredible medical staff. And it's a privilege to be with these trustees who provide so many hours of service, not just every month, but every day, it seems. To review our mission is to advance the health and well-being of the communities we serve. We are a not-for-profit healthcare foundation. We share that with our friends that are here from EPRDA. Basically, what that means is we don't have stockholders, we have stakeholders. We believe that everybody in the community that we serve are stakeholders in the organization. Our vision is to create an extraordinary experience every time. We've tried to hold ourselves to this standard. We know it's a stretch sometimes, but our staff are committed to creating that extraordinary experience, and that's our aspirational goal, and we know sometimes we fall short, but we work toward that every day as we try to serve this community and the patients that choose us. Just to give you a little sense of Lancaster General and the hospitals that we represent, we have our acute care hospital that we're sitting in. It's the county's only trauma center. We see several thousand trauma patients every day or every year. We're a regional referral center for tertiary patients. We have close to 600 beds here at this hospital, and we have 28,500 discharges from this campus. We also have about 3 miles west of here, Women and Babies Hospital. At Women and Babies, we have close to 100 beds. It's 98 beds with close to 10,000 discharges last year. Finally, we have our Lancaster Rehabilitation Hospital. It's a freestanding rehabilitation hospital with 59 beds, and we had 1,000 discharges last year. So close to about 40,000 plus discharges at our 3 institutions. Just to give a sense, we have about almost 40 locations throughout the county. We have 11 ambulatory locations, 16 primary care practices, 13 specialty care, 1 urgent care practice, 4 LG Health Express practices, some at Walmart and some at Giant, and we have a total service population that we serve of just slightly over 1 million people. We have a tripart mission here at Lancaster General Health. As part of advancing our mission, we do first and foremost through clinical care. We also have substantive educational programs that I'll talk about in a minute, and we also do a substantial amount of clinical research as well. One of the hallmarks of Lancaster General Health is our College of Nursing and Allied Health Sciences. It's fully integrated with Lancaster General Health. We have a 10-year accreditation for middle states. Those of our colleagues here from education realize that that's no small feat for a relatively young college. And we have over 1,400 students. Many of those students are first-generation college students, so it's a tremendous opportunity for someone to move into a college situation and then really get a lifelong career in a profession, one of about 11 different degrees that are offered. We offer both associate degrees and bachelor's degrees at the college. Our 7 strategic goals, and we have board committees that oversee each one of these goals. Our community benefit, that group of board members, which is actually chaired by the vice chair of the board, provide oversight to assure that we give substantial dollars in community benefit through care for the poor and underserved. The criteria nationally is 5% of your net revenues. Last year we gave 10%. At Lancaster General, we're very proud about that. But the board is really concerned about assuring that Lancaster General Health assists in assuring that the health of the community is such that we become a standard across the state. About 5 years ago, we ranked 17th of all counties. Lancaster now ranks about 8 in the counties in Pennsylvania as far as health status. We continue to try to drive that in the top 5. Extraordinary People is recruiting and retaining the very best people that we can find. We have about 15 applications for every position at Lancaster General. We really try to make sure that not only do they have the medical and nursing and technical talent, but in addition to that, they are aligned with our values that are very important to us. We do an extraordinary amount of health sciences education. We mentioned both the college, but we have a residency program as well. And in addition to those programs, we have ongoing education for our staff and a large adult education program. Physician engagement, our medical staff clearly are the reason why many people come to hospitals, both on an inpatient side and an outpatient side. And our physicians are our closest colleagues in assuring that the quality of care that we provide and the technology and capabilities are always up to date. On quality, we have a senior executive and several physicians involved full-time in quality activities, and clearly trying to assure that we learn from every experience to provide quality, and we also learn from when mistakes are made. But we have an absolute commitment when mistakes are made is to have full transparency. You'll see that our quality data is on our website. You're welcome to look at that at any time. We try to update that on a regular basis. Clearly, we want to continue to grow with the needs of our community. One of those responses in the last year was to put up an urgent care center. We weren't sure whether or not there'd be an interest in urgent care. Our emergency department had already been at 110,000 patients. We built it, I think, about 7 years ago with a capacity of 100,000, and we exceeded that amount relatively quickly. Our urgent care center, I think this year is going to see about 22,000 patients, so it's a pretty active urgent care center. And then the other piece is technology optimization, and I'll talk a little bit about that, and I know Dr. Rubczynski will when we talk about My Health and the electronic health record. We produce, and you're welcome to get on the mailing list, a journal of the Lancaster General Hospital. It's an educational resource that we send out to about 5,000 healthcare leaders throughout the region, primarily physicians and nursing leaders, and it's dedicated to assuring quality healthcare in central Pennsylvania. There's a number of scientific reports that are written by our medical staff concerning a great deal of their research, and they make that available to other physicians and people who are interested. It's also available on our website as well. Just a little bit about our Clinical Research Institute. We provide support to a number of different entities across our health system. We do research conducted on both treatment and diagnostic and procedural efficiency in the hospital and the affiliated areas. Many of our residents do, in fact all of our residents do research projects during the time that they're here, and we continue to try to promote medical education. We also are involved in a number of clinical trials in cardiology, oncology, trauma care, cleft, lip, and palate, and we have a number of national and international trials that try to foster robust exchange across not only the continent but across the world. We have the family medicine residency is one of the oldest family medicine programs in the United States, freestanding. Started almost 40 years ago and continues to provide medical education to a number of residents. We have almost 40 residents in the program, all from American Medical School, some of the finest student physicians in the country, and it's been a real privilege. Of the 400 and some residents we've educated from the beginning, probably about 35% of those, well over 200, continue to practice in our overall community here. And they receive a top-notch educational experience, and they make major contributions. We actually have a dual track that allows students who want to treat the inner city poor to do a dual language track, so folks that don't have Spanish as a first language learn how to speak Spanish in order to be able to communicate appropriately with their patients. We just received word that we received a grant. We didn't get the $103 million. If you did, I'd be jumping up and down. But we were only one of 2 entities in Pennsylvania. The other entity in Pennsylvania was the city of Philadelphia to receive a community transformation grant. We're working with a number of entities across the county to really provide the infrastructure to address a number of key health priorities in Pennsylvania. Interesting enough, we beat out the state who applied for the grant, so we're really excited about that. We got a $234,000 award for the first year, and then the subsequent years we'll receive $1 per member of the community, so probably about $500,000 to help us work with a number of our colleagues across the county to be able to provide services in tobacco-free living, active living, and healthy eating, and increase the use of high-impact preventative services as well. Some of the technology investments that we've had the privilege to make over the last couple of years is that we have 3 Da Vinci robots to do microsurgery across the health system. We have 11 of our specialists are trained across the full continuum of care, including general surgery, gynecologic, urologic, and also cardiovascular surgery. We just opened up 2 weeks ago a new vascular lab and a new laboratory department. One of the things that we participate in every year is a goal-setting exercise to create a strategic plan and to evaluate the success on the plan that we developed. We did scenario planning about 3 or 4 years ago. It might be longer than that. Damn, the years are going by so quickly. And where we really tried to predict what would happen 25 years out. We had technology experts from around the country come and challenge the medical staff and the leadership of the board and management team to really try to think outside of the box. And then every year we convene close to 100 folks. I think this year we probably have close to 40 physicians from the medical staff, along with leadership and board trustees from all of our boards, to really focus on strengthening our organizational performance, quality, financial performance, enhancing the patient experience, and then also preparing for healthcare reform. I'll talk a little bit about healthcare reform later, and then later on in the evening we'll really have somebody who's an expert in that talk about the challenges that we're being faced with. So, you know, Congress is looking at the budget appropriately to see about healthcare expenditures. But what they're purporting to be talking about is the reduction of payments to physicians and hospitals rather than the remediation of the amount of services that have to be provided. So one of the challenges for healthcare providers is to figure out how to do that within the context of significantly reduced reimbursement. Some of the things we're trying to do to strengthen performance is improving clinical quality. We're paid by length of stay. We're paid on a per case basis. As a consequence, we've been able to reduce our length of stay index for patients over 65 by about 5%. I can tell you patients like that. They like to go home when they're supposed to, so we really work on that. And we're also almost in the top decile nationally in reduced mortality. We have a 28% less than expected mortality rate for the patient population that we serve. We work, because we have a febrile and older population of patients, we work to reduce the fall rate. We have a number of patients, who can't walk on their own. They get out of bed and they can fall. We have significantly reduced the number of falls. We obviously are trying to drive that to zero. We have one of the lowest hospital-acquired infection rates in the state, and really, I'd love to take credit for that, but we have, I think, the best in the state infectious control, disease physicians who have worked with our primary care physicians across this community to assure the proper use of antibiotics, which is really dramatically, it's put Lancaster on the map as far as hospital-acquired infections. And then finally, we just recently received our third magnet recognition. Kudos to the nursing department for quality. This is a recognition around the world, and we're one of only 30 in the world that have been recertified our third time, so we're really excited about that. Our financial performance, currently our balance sheet performance equals or exceeds S&P AA and Moody's AA, meaning that's what that means is we have access to capital at more affordable rates. One of the most important initiatives that we did last year and have been preparing for the last 4 years is enhancing the patient experience through the implementation of our eHealth initiative, which is the electronic health record. Now we use a single common medical record system for inpatient and outpatient services. Hundreds of physicians across the health system use that same medical record. I'm excited that you're going to hear more about that. But the My Health personal record, I can say from a user, it allows me to actually get into my own medical chart, look at my data, be very transparent, and then communicate with my primary care physician and ask them questions online. It's really been phenomenal for me. We opened our 4th retail clinic this past year, and also we're soon to open our 2nd urgent care center, which will be at 322 and 222. One of the things that we're in the process of doing now is really realigning the structure of the medical and dental staff, thanks to the leadership of Dr. Ray Foley and before Dr. Foley's predecessor, Dr. Deb Riley, to really have clinical chairmen that are part of the senior leadership team, and we've been working toward that end over the last year, and we're excited that that's starting to occur. Our heart group of Lancaster General joined us, and we are in the process of developing a nationally recognized cardiovascular institute. We also recognized the need through a lot of input that we got from the community to have access to the underserved population in the area of dentistry. We are able to create a dentistry residency program that requires inpatient experience and affiliation with the hospital. Doing a lot of work on clinical integration. We have a number of folks working on improving care coordination, disease management. Disease management is essentially trying to avoid hospitalization by properly managing in the outpatient setting chronic diseases like diabetes, allergies, things like that, so patients don't have to come into the emergency department. Through programs like that, you can mitigate not only patient admissions to the emergency department, but significantly reduced, sometimes to zero, deaths from improper use of inhalers, things like that, through asthma as an example. The other thing that we're very proud of is the partnerships we're developing with other providers. Effort Community Hospital, John Porter, who's the president and CEO of Effort, is here this evening. We work on a number of partnerships with Effort Hospital and continue to seek ways that we can work collaboratively together to serve our community. Well, we're preparing for healthcare reform. Just to give you a sense of scope, the proposed reductions through the Health Protection Act, Obamacare as they call it, for Lancaster General alone is $138 million. So that's the kind of savings that we're trying to look at just in the short term to stay viable. So we have some challenges ahead. So that really does require us to work in a different and more collaborative way and look at more cost-effective ways to care for our patients. So it's not out of the realm to look at ways to care for patients in their homes, to really rethink the way we provide services. So we're trying to think outside of the box. To that end, we've set up a center for innovation. That Center for Innovation is really going to be a separate board of trustees. I've asked Mary McGowan, who's the president of Lancaster General Hospital, to also be the president of that new company, and we're really excited about the work that we're doing in that area. We're also preparing for getting bundled payments. Bundled payments is essentially having one payment that goes for all the physicians, the hospital care, inpatient care, outpatient care, and Medicare, and a lot of the payers are heading toward that. So we're trying to make sure that we're ready to be able to deal with that new initiative, and also maintaining clinical quality and patient safety. Clearly, we know that patients rely on us and they trust us, and we have to have the best interests of our patients at heart. So they're the focus of all of the changes that we're making, the focus of all the work that we do on a daily basis. We've been privileged over the last year to receive the following awards. The Ethics in Business is one that we're very proud about, but we're listed in the top 50 hospitals in America by health grades for both patient safety and best hospitals in America. We showed up in Consumer Reports as one of the best cardiovascular hospitals in the country, and our cardiac surgeons were rated the top in Pennsylvania, and also on U.S. News and World Report in about 9 different specialty areas. Really the point there, what we wanted to give you an update is to say that we continue to strive. We know we're not perfect. We have enormous challenges ahead. We're particularly interested this evening in getting your input on things that we could do better, creative ideas to look to the future, and we're looking for more and more community collaborations as far as how to help all of you, how to help your businesses reduce the cost of healthcare, which we know is enormously expensive. We know that because in addition to being a healthcare provider, we have to buy healthcare for our own staff. So I look at a healthcare bill of close to $50 million a year for the people that we serve, the over 8,000 staff that we have and their families. So we recognize the challenges, and part of the purpose of this kind of meeting is to get that dialogue going when we can, so that we can really learn from you as well as tell you what we're about. So, Mr. Chairman.
Thank you, Tom. I hope that gave you a good overview of the kind of things we are working on. And as our CEO, Mr. Beeman, said, after the meeting concludes, when we're next door, we'll have 45 minutes for you to mingle with the board members and hopefully give us your ideas, as well as if you want to fill out the cards I mentioned and put your email on. That would be another excellent way of doing it. I would like to move now to our committee reports, and the first of those is the report by Dr. Foley from the Medical Executive Committee of the staff. But before I turn it over to Dr. Foley, I want to talk a little bit about an item on the agenda called the consent agenda. And what we do is, obviously the board receives a fairly extensive packet, as you can imagine, before our board meetings. And one of the parts of that packet is what we call the consent agenda. And on that consent agenda are a whole series of items that we approve. And just to give you the example of what it is, we're responsible as a board to approve the members of the medical staff. So the consent agenda includes physicians who are being reinstated to the staff. It includes medical affiliates that are being appointed. It includes requests for additional privileges. It includes resignations. It includes regular medical staff appointments. It includes items of that type. So we review the various physicians that are being appointed to those positions. In addition, the consent agenda includes things like looking at the delineation of the clinical privileges that various departments and divisions would have. At this time, for example, we're looking at pediatric cardiology as one of them. Another item that goes into, and also similarly the Department of Family and Community Medicine, core privileges in family practice, and we're responsible to look at what those privileges are and to approve them. Additionally, we review the minutes of the various committees that we have. There's a patient safety committee meeting, which is entirely dedicated to analyzing any errors that may have been made, looking at ways in which errors can be eliminated. We have what's called a root cause analysis of any error, where we examine what's occurred and how it can be corrected. We look at the patient safety indexes. We have the Environmental Care Committee, which looks at care and how that can be improved, and that's another matter that we look at. We have a Performance Improvement Council, which looks at all kinds of things, our e-health program and how that's proceeding, and various other procedures that the hospital is engaged in. So all of those items are part of things that are reviewed by the Board of Trustees in preparation for each meeting and then approved at the consent agenda. So I'd like to turn it over to Dr. Foley at this point, who is over here with the stethoscope, and he can give us the report of the MedEx committee and also anything he wants to add to the consent agenda items.
All right. Thank you, Mr. Chairman. I've been president of the medical and dental staff for about the last 15 months, and each month my report to the board begins with a report on a medical staff restructuring. So the board is very familiar with that. For those in the audience, I thought I'd just give you a brief update on what that involves. Dr. Beeman alluded to it. Well, it all began several years ago. Dr. Riley, sitting over there to our left, and a team of physician leaders and hospital leaders embarked on a journey to restructure our medical staff to enable our physician leaders to serve as chairs and chiefs, chairs of departments, chiefs of divisions, so that they could dedicate a substantial portion of their time to help us focus on providing efficient care and quality care to our patients in an age of what everybody realizes, I think, is extraordinary change in the healthcare environment. It's been a long journey, has it not, Deb?
Yes.
And part of the reason it's been such a long journey is part of this, the initial process of this is changing, began with the change in the medical staff bylaws. And we have about 750 or 800 active staff physicians at Lancaster General Hospital. And to get all of those physicians, or a majority of those physicians, to agree on any one change is certainly a challenge. But it took us a while, but we did get everybody on board, I think. And then we designed a process that's somewhat involved, but it involves a number of interviews. It involved, first off, a nomination process to get some interest in these positions, and nominations either by themselves or by their cohorts. There's a couple interviews involved, and then there's a balloting, and in some cases several ballots, before we get down to the deciding on who a chairman of a department might be. Well, we're nearing the end of that process. There are 10 departments, and the following departments have either elected or identified a single candidate to be their chairperson. And they are departments of psychiatry, departments of emergency medicine, department of anesthesia, department of pediatrics, department of pathology, and a department of radiology. There are 4 remaining departments, and each of these departments have identified 2 candidates, and the elections are ongoing or are shortly going to begin. The Department of Medicine, Department of Surgery, Department of Family and Community Medicine, and Department of Obstetrics and Gynecology. So we're optimistic that by the end of, I see Mary Miskey over there, Mary's been very involved in this, but we're all optimistic by the end of this calendar year we'll have identified a department chairperson in each of our 10 departments, and then that will then enable us to go further in the processes of focusing on delivering quality care to our community. And I just wanted to tie in one other thing with that. Last week I had the opportunity of attending with Paul Casal. Dr. Paul Casal is a cardiologist of the Heart Group, and he was our Chief Quality Officer. He and I attended a conference given in Boston by the Institute of Healthcare Improvement. The Institute of Healthcare Improvement is an institute dedicated to quality care. It was begun by Dr. Don Berwick, who is a pediatrician at Harvard, and who now serves as the director of CMS. It's a Center for Medicare and Medicaid Services. So he is extraordinarily powerful, and he's been a thought leader in quality throughout his career. So Paul and I spent a couple days up there last year, and the theme was quality, providing quality care with an emphasis on department chairmen and division chiefs. And there were two overriding themes. And one was that it has to be the department chairperson and the division chiefs who are going to be the drivers of quality in medicine. You know, they are our colleagues, and they are going to be our leaders, and they are going to be the people that drive quality care of our patients. When we started the process of medical staff restructuring, that was our focus, and that continues to be our focus. The second theme that they talked about was that healthcare organizations will only be successful financial organizations if they are able to provide quality care. They give several examples of that. There's a fellow, the chief quality officer from the Mayo Clinic, that when they look at their financial costs, for every dollar that they invest in quality, they get a $5 return on investment. So it's clear to us that you need to set, in order to be successful, you need to set audacious goals with reasonable timelines. I think we're all in line to do that, and I'm confident that by doing that, we will be well positioned for the future. That is my report, Mr. Chairman.
Thank you. And I do want to say that you heard all the things that the system is doing that Tom Beeman reported. But there's nothing that's more important than we do than having our physicians be excited and engaged and leading the transformation that needs to happen. And Dr. Foley and Dr. Wiley have done a great job in leading that, and the physicians have done a great job in becoming excited about it, and we're really thrilled the way that is all coming together. So having said that, I would accept a motion to approve the consent agenda and accept the committee report given by Dr. Foley.
So moved.
Second.
Any discussion on either of those items? All those in favor say aye.
Aye.
Any opposed? Motion carries. Thank you.
Now, I know financial reports, and financial reports are all numbers, and numbers are boring, okay? I've been allotted 1 minute and 38 seconds to go through these slides, and I promise you I'm going to do it in less time than that. So here we go. This says a financial report for the 3 months ended, or for our fiscal year, 3 months ended September. This is patient care year to date. We like to compare to the prior year, prior periods, and also to budget. And as you can see, our volume is up slightly. We look at emergency visits, they're up. Fast care emergency visits are down, but as you heard Tom say, urgent care is more than made up for that, and that's a positive thing. Occupancy rate is up 2.9% over last year. Payer mix is important to us. You see that we're up 17 inpatient discharges, and there's the mix. Enough said about that. I'm still on time. Revenue analysis. We're living on rate. This slide tells us it's a lot more detail. We talk about it in the meetings. But rate increases have produced increased revenue. But because of reduced demand, it's not declining anymore, but it is somewhat reduced. That's down. That's the payer. That's the mix. Quickly on the balance sheet, if you look at the assets, we're down 13%. However, that is nothing more than a cash transfer that we made during the year. We have moved some cash and investments from the balance sheet of the hospital to the parent for investment purposes. Days of cash on hand is very positive. Tom alluded to that. The benchmark's 284, we're at 294, and our financial ratios are all very solid and very good. As I said, we like to compare to last year and also to our budget. You can see revenue comparisons after 3 months versus last year. We're down slightly. Expenses are up slightly, so we're down in income. Versus budget, we're down 4.7 in revenue. We have saved expenses compared to budget, so our operating income is up about $2 million. You can see the numbers. You can see EBITDA. Important line here, care to uninsured and underinsured was $6 million in the first 3 months, up about 8% compared to last year. Summary, the hospital's balance sheet, believe me, is very solid. Remains solid. You've heard about our bond ratings, etc. Operating income is about 7.7%, better than budget, slightly less than last year. Operating income for the first 3 months, 15.9 million, better than budget by the 2 million I told you about, down about 10% from last year at 1.7. And there you see the consolidated income number, and that was it in 96 seconds. Thank you, Mr. Chairman.
Very good, Jenny. As you can see, and as Mr. Getz reported, we are in very solid shape financially. Having said that, we are by no means immune from the current economy, nor from the changes that healthcare reform is affecting. We do, however, continue to plan. We do continue not just to react, but to plan for what's going to happen. And I have no reason to think we will not be able to continue to do that with the great success we've had in the past.